Today's date is June 21st, 2016. We're back again with Bill. I saw him 2 weeks ago. We did Prolozone on him, and we did, he's got a follow-up for us about how he's done. Let's see your range of motion of your neck, Bill. Turn your head to the left and right as far as you can the other way. Good. And now up and down. And up. Okay. Your neck, you said, has held really well, right?
Correct.
And your neck doesn't need any more work.
No.
Your hips, you had a couple tough days, but then you said after about 3 days it got significantly better, and you walked in here today without a cane.
Correct.
That's significant improvement, isn't it?
Significant, dramatic.
Okay, dramatic.
Dramatic difference.
Thank you. I like hearing that. And I'm really glad that you came in here without a cane. So that's
Thank you.
good. We did another round on you today. We'll just see how it does. The results can be delayed. I told you that in the beginning.
Correct.
I never know. You can get immediate results, and you can get results 4 or 5 days later. I never know. It depends upon the individual. But you're okay with this, correct?
Yes, sir. Absolutely.
Very good. I may post this on YouTube.
You certainly can.
Thank you. Today's date's August 4th, 2016. We're here with Bill, who comes to us from Sacramento. And I did part 1 of this before. Bill, in 20 seconds, summarize your problems.
I have a 22-degree curve in my neck. I have multiple arthritic spurs in my spine. I have 3 protruding discs in my lumbar spine. I have severely diminished cartilage in my left hip, and I have a deformed sacrum.
And you've been with me now for how many sessions?
This is the 3rd.
Okay, and you received Prolozone, and you've had some results, yes?
Yes, dramatic results.
Okay, in fact, you told me you've had some days without pain,
Correct.
and then you overdid it by moving, right?
Correct.
And then you had problems again.
Yes.
Well, today you brought me in a copy of what's going on in your teeth. You have 3 root canals.
Correct.
I muscle tested them, and they all tested positive.
Correct.
And I went for what I thought was the worst first, which is number 9. It's an incisor,
Mm-hmm.
and it deals with the kidney bladder meridian, which is going to control your whole spine, the entire spine. Tell the viewer what happened after we injected the tooth point.
My motion was as close to being normal as it has been in 10 years.
10 years, your gait was as close to being perpendicular as it has been in 10 years.
Correct.
Yes?
Correct.
I noticed a change. Did the 2 other teeth do anything for you?
Yes, a lot less pain in my left hip and in my knee.
And in your knee. Okay. The kidney bladder meridian controls the knee too, generally the back part of the knee.
Correct.
Were you having trouble back in the back part of the knee?
Yes, I was.
That fits. Okay. What about your shoulder?
My shoulder will generally not go up to 90 degrees in a lateral position. And
now,
today it was above 90 degrees.
It was above 90 degrees after I did your tooth, right?
That's correct.
Okay. And I think you gave me, on a scale of 10, you said your overall improvement or pain dropped 7 points on a scale of 10.
Correct.
Right?
Correct.
So if you had 10 points of problems and 0 was no problems, you had 70% improvement.
Correct.
Right? That's remarkable. Can I see you get up and walk to the door, please?
So when I first get up, I have that apprehension.
And walk to me. Walk a couple times.
And my knee's not locking back, so it's not affecting the popliteus in the back of my knee.
Okay, you can come back and sit down. For the viewer, you were swaying a lot more when you walked in the door, right?
Correct.
Going like this.
Yeah, waffling.
Waffling. Okay, so that's dramatically better, and that's just doing your teeth. So when I checked you for doing your back, you didn't check. Your back told me I don't need a treatment.
Correct.
And we went and we just did your hips. And so we did that today. And in the meantime, I'm going to tell you that a lot of the problems in your back could be coming from your teeth. And you admitted you had problems all the way up and down your spine. And I'm telling you that the incisors dealing with the kidney bladder meridian are going to have a lot to do with your entire spine. In fact, the entire spine. The kidney in Oriental medicine deals with bones anyway. So your entire spine is involved, and when you have degenerating levels in so many different areas, I kind of look to that. Please get that squared away before we mess around with trying to inject joints again.
Okay.
All right, because that's going to put a heavy lid on it. And you had 2 other teeth that were involved, and I think all 3 of them have problems. Would you tend to agree?
I would, absolutely.
What did your dentist say about your teeth? And
Well, he was concerned that he wasn't going to be able to save the 3 teeth, and that this was probably a temporary fix.
Okay, and I confirmed it my own way that all 3 of them were problematic. Okay, may I post this on YouTube?
Yes, sir.
Thank you. I wanted to get one last thing on you today. When you came here, weren't you using
The cane.
that cane over there?
Yes.
You couldn't walk in here without it.
No,
How much of the cane are you using now?
not at all.
Okay, thanks. I think you also told me that you were not able to stand on one leg before you saw me. Is
That's
that right?
correct. That's correct.
Let's see what you can do now. And the other one? What do you think about that?
That's exciting. Exciting. I may be able to run in the 80-year-old Masters.
It makes my day to see something like that.
Thank you very much.
Thank you.